If you suffer from unsightly and sometimes perhaps embarrassing varicose veins, well, we want you to listen up. Established in 2003, Invisivein is a leading provider of high-end laser technology for vein treatment. And Dr. John McGue specializes in this type of treatment, and he joins us today to discuss more. Good morning.
Good morning.
Thank you for joining us. And what exactly is a varicose vein?
A varicose vein is a often painful vein that bulges above the top of the skin. The technical definition, it has to be greater than about 4 millimeters, which is about a quarter inch.
What causes it to do that?
We don't really know what causes the underlying problem, but there are, the long description is that there are valves in all the veins in your legs that help the blood get back from the legs back up to the heart. And it's an uphill battle coming, from the feet all the way back up to the heart. The blood is pushed to the tissues in the legs by the heart. It's pushed in the arteries. But coming back is a much more passive process. And the blood typically gets there because the muscles of the calf and the thigh squeezes the veins and squirts the blood up. But in order for that to work, you need to have functioning one-way valves. So when the calf contracts, the valves open up, the blood rushes up. But then when the calf relaxes, the blood wants to go back down. So those valves have to close and prevent that. And the underlying pathology, the thing that goes wrong in most varicose vein patients, is the valves in some of those veins have failed. So you get to and fro motion of blood in the veins, and the blood just can't get out of the legs well. So, and veins can't handle pressure. They're very thin-walled, almost papery thin blood vessels, and the only thing they can do when they're subjected to increased pressure like that is to dilate up. So what you see on the skin is the result of failure of the valves in some of the main veins in the leg, and then everybody has normal veins underneath their skin. So the varicose veins you see in patients used to be normal veins, but they've been subjected to unusually high pressure for a long time, and they dilate up, they become unsightly. And it's more than just a cosmetic problem. Most of these patients get significant symptoms, most commonly pain. Everybody gets a little bit of achy pain after they've been on their legs all day, but for patients with varicose veins, it's pretty severe.
Now let's talk about the treatment of varicose veins, procedure, a laser treatment, EVLT. What does that stand for, and why is that the best way for treatment?
It stands for Endovenous laser treatment. First of all, you got to go back. What did we used to do for varicose veins? And there's a term out there that a lot of people have heard called vein stripping. And
that sounds painful.
Yeah, it just sounds painful. And a lot of people have had a grandmother or mother that had a vein stripping procedure in the past. And it wasn't that bad of a procedure in that it worked, but it was significantly more invasive than what we offer these days. They used to make a fairly large surgical incision in the upper thigh and then below the knee, and used a rigid instrument to strip out what was called the great saphenous vein. There's one big vein that runs down the inner aspect of the leg, which usually causes most of the problems. So now we're much more elegant. About 15 years ago, people started developing much more elegant ways of getting rid of that main refluxing pathway. You'd make just a little nick in the skin about that big, put a small tube in there, and then use a device to heat up the inside of the vein. And what we use is we put a small fiber optic in there, hook it up to a laser. The tip of the laser gets hot, and we slowly withdraw it, and it cauterizes the inside of that vein. And it treats the underlying problem, those refluxing pathways, so that the veins are no longer subjected to increased pressure.
That sounds easy. And of course, I know as we get ready to wrap up here, how soon will a varicose vein patient see results after this procedure?
There's some bruising and a little bit of pain immediately after the procedure, but and we wrap them up in a compression stock and ask them to wear that for several weeks. But I'd say the big turnaround time, about a month later is when they're going to be really feeling good. They come back for that month follow-up visit, and they're feeling good, and they feel much better.
And that's good. Well, right quick, folks need to get a consultation. That's always best. And there you see the information on the screen and how to get in touch, 881-4020 or invisivein.com. Make sure you call today for an appointment. Dr. McGue, thank you so much. And I think I really had a visual of that. You explained it so very well. Thank you.
Thank you.
Much more Low Country Live right after the break. Stay with us.